Hello everyone, my name is Nicole and today I'm going to talk about key ethical issues and implications in research related to communication, specifically within an allied healthcare. Scientific communication is grounded in a few essential principles. The first one is accuracy, which is presenting information and research findings truthfully without distortion. The next one would be clarity, which is sharing information in a way that is understandable and relevant for the audience. Next would be objectivity, avoiding bias, emotional language, or personal opinions when communicating research. Following that would be transparency, which is clearly explaining methods, limitations, and potential conflicts of interest. And finally, integrity, which is avoiding plagiarism, data manipulation, or selective reporting. These principles help ensure that research can be trusted, replicated, and applied correctly in clinical practice. Allied health professionals must follow ethical standards when conducting or participating in human research. This includes protecting human subjects through informed consent, privacy, and confidentiality. Following the Belmont Report principles, which is respect for persons, beneficence, and justice. Also ensuring participants understand the purpose of the study, any risks, and their right to withdraw at any time. And last is maintaining HIPAA standards when handling patient information. By honoring these ethical obligations, we protect vulnerable individuals and maintain public trust in healthcare research. Communication itself can raise ethical concerns. Some key issues include miscommunication or unclear instructions, which could place participants at risk. Not disclosing risks completely, which violates informed consent. Using overly technical language, preventing patients from fully understanding the study. And data misinterpretation, whether intentional or unintentional. Ethical communication in research means sharing information honestly, respectfully, and in language appropriate for the participants' literacy and culture. Effective communication within the scope of practice includes using plain language with patients and families to support understanding, practicing active listening, empathy, and asking open-ended questions, using closed-loop communication with the healthcare team to ensure accuracy, respecting professional boundaries and making referrals when patient needs fall outside your scope, and maintaining confidentiality when discussing or documenting information. These strategies help build trust and prevent conflict or miscommunication. As allied health professionals, we must also communicate clearly in writing. This includes writing with professionalism, accuracy, and proper grammar, using a formal tone and avoiding slang or abbreviations not universally understood, organizing information logically, your introduction, then key points, and a conclusion, ensuring documentation is objective, timely, and aligns with organizational policies, and citing evidence when appropriate to support decisions or recommendations. Strong written communication helps ensure continuity of care and supports legal and ethical accountability. In summary, ethical and effective communication is essential in research and in daily clinical practice. Following principles of scientific communication, respecting human subjects, and communicating clearly with patients and colleagues helps ensure safe, high quality, and ethical care. Thank you for watching.